make it an active point when you speak to seniors in the industry or other experts. Please ask them, what are the challenges. And I really like the fact that, it's one of the few podcasts there where people have asked about challenges. I don't think most podcasts that I've been a part of, it's mostly always been about, the bright side of things and the overall landscape and all of that. And this, I think, is a very, very welcome change where you are targeting it to people to understand that there can be challenges and there will be challenges. So I think there is not enough understanding of any of the paraclinical branches for people, because you see it in second year and then you don't see anything about it. And one of the challenges, of course, is the whole mindset shift.
All the industrial roles that one can get into after doing MD pharmacology and how it is different from MBA pharmacology.
So I think there is not enough understanding of any of the paraclinical branches for people, because you see it in second year and then you don't see anything about it. And then of course even in second year you are mostly doing your clinical postings and you are busy with that and you enjoy that so much. And of course the end goal of any medical curriculum is to make you a good doctor. For the MD pharmacology curriculum, again, it is not yet designed to accommodate industrial roles. It's designed very much for research and academia. That's because that has been the traditional understanding of what that degree can lead you to. There is no MBA in pharmacology particularly. Some colleges offer MBA in pharmaceutical management, which is very different because it's like a typical MBA kind of a course where you have business courses, but very focused on the pharmaceutical industry, the pharmaceutical business, their marketing, operations, supply chain, business excellence, and domains around that, which mostly lead people to become product managers, brand managers, and marketing managers in pharma companies. Your industry roles in MD pharmacology are multiple. One is, of course, medical affairs, which I started with, where you become a medical advisor, and then there are vertical paths within it, multiple therapy areas, multiple domains. There is clinical research. There is clinical development. You can be involved very actively in clinical trials and work on those things, right from strategy to execution to monitoring to safety, etc. There's also a large scope in pharmacovigilance, which is around drug safety reporting. And that again is a huge industry and a lot of people opt for it. The others are around, medical writing, medical communications and scientific communications domain, which some people have a passion and flair for writing, for publications, and some who are creative in medical communications would like to opt for those. These are more or less, the conventional paths that people take. Of course, there is academia. There's hardcore research as well that a lot of people may like. And today, a lot of people want to opt for many things beyond it. Right? There are people who will take up MD and now maybe venture into health tech, venture into digital space, venture into the startup world. I think those are all very degree agnostic. So I think a lot of things, the degree gives you probably a foot in the door, and then it's of course a lot of other skills that you develop. So for MD pharmacology, I think the journey is a little tough in the way that the curriculum is not designed to make you an industry expert. So you have to take up efforts and try and do it within your MD to get those skills and become trained enough to be in the industry, because you are then dealing with people who are not always doctors. So in most other branches of medicine, you're always dealing with some other branch of medicine. If you're a radiologist, you're probably dealing with a physician, a surgeon. When you're talking to them, you are an anesthetist, you are dealing with a surgeon when you're talking to them. So typically you're dealing with mostly people within the medical field or the paramedical field in a hospital setting. When you enter the industry, when you enter the corporate world, when you enter the startup world, etc., you are dealing with all non-medicals, and then you have to have that right mindset that it's not the hospital, and it doesn't work that way. They don't understand all the terminologies that I am putting across, and your communication has to be very, very different. Your attitude has to be very, very different than what you probably would have in a hospital. So those things also need to be learned, which are uh, very, very important, but often overlooked because they don't form a part of any curriculum or formal learning.
All right, sir. Thank you so much for the wonderful insights. Now, I want to explore more about the challenges you faced during transition. So, can you brief us over what were the biggest challenges that you faced when you tried to transition from traditional medicine into the leadership in healthcare?
Challenges from traditional medicine to healthcare, so to say, leadership. Uh, I think one of the challenges, of course, is the whole mindset shift to begin with, where you don't actively deal with patients. You move out of a clinic setting to something very, very different. So it's a mindset shift for yourself. Two is also navigating, like I said, the whole societal things around, not conventional, not traditional medicine. Then there are all these other skills that you need to really learn and develop things on the go, on the job, which I think at every role, every domain, you have to start thinking about how you're going to present things, how you're going to navigate that kind of a journey. We've very typically seen hierarchical structures in traditional medicine. If you see any department in a hospital, you have the head of department, you have professors, you have associate professors, you have lecturers, you have assistant lecturers, you have senior residents, and that's how the hierarchy very typically flows. And the corporate world comes with a matrix environment. Now, you've never heard that term till you enter the industry. You probably have seen matrix movies, but you've not heard what it is. And it's like, okay, every function is touching somebody here. You are not directly answerable to them, but in the hierarchy, they are somewhere here. So navigating that is complex as well, right? Understanding what that function means, what his or her role means in that function versus how it impacts me here and how I'm supposed to interact with them. Uh, Communicating your ideas to different stakeholders, understanding the corporate, I think, language itself, a lot of lingo, a lot of jargon. Earlier is what I used to call it, corporate tamjam with very, very fancy words and different words, the way you don't generally talk. It's in a hospital setting, you are mostly like, you have to do these five things for this patient and it's done. And here you are talking about, we'll circle back and let's, stakeholders, internal, external, lot of complex words, beautiful slides, and so you have to learn to be one of them, which again is a journey. And then it's about, of course, navigating the whole corporate world. The challenge is also on both sides because earlier in a medical affairs role, you are dealing with key opinion leaders who are like specialists in the therapy that you are handling, and then you have to deal with them. You have to deal with them in a peer-to-peer way. Talk to them medically, be very scientific at the same time, keep the interest of the company in question as well. So that navigating that path is again one of the things. Then, of course, transitioning when you are in corporate, you again feel, how you're going to have a career path, your ambitions within corporate, the promotions and, the visibility, the scale of work, the scope of projects, and how you do better and become a better performer at many, many things. And so I think those are again other set of challenges that come in. And then into the startup world, I think the challenges just skyrocket into something very, very different. So it was again a shift because corporate was very, very organized. You are doing like annual plans and 5-year plans, and you're doing quarterly reviews, and The moment you come into startup, it's like a day-to-day thing. So you don't know what tomorrow what will change, or today what will change. And now when building one, I think it's not even a day-to-day thing; it's a minute-to-minute thing. Like I don't know what will happen the next minute, right? I mean, suddenly you might have a lot of things, and then getting into hands-on, like knowing I have to do this. Nobody else is there to do this for me. When you have been in corporate or even in leadership in startups, you've been able to delegate things to people. So you've had helping hands, you've had that, and then now getting into that hustle mode, fully rolling up your sleeves and getting your hands dirty is is the new thing to do. So lot of transition, I think, comes with a lot of challenges, but change is the only constant, and accepting that change and seeing how we can make the most of it is, I think, the attitude you need to follow. And you have to be a work in progress forever. So I think we are all the time transitioning in a small scale to a large scale, sometimes without realizing it. But if we go back and see how we were a couple of months ago, a couple of years ago, we'll see we keep evolving. I think humans evolve all the time. So I look at transition more as evolution.
All right, so thank you so much for putting this wonderfully. We will be diving into the next segment, that is career insights. So, what is the advice you want to give to aspirants who want to transition their career into non-clinical sides of the healthcare?
So I think I'll give this with a word of caution. Sometimes, when you listen to things like these, listen to these journeys, like you said, the challenges are not always highlighted, or they don't come across in depth, right? Because we're trying to cover a lot of aspects, cover a lot of things about the career, about the journey. So there is a word of caution, right? It comes with its fair set of challenges. I have tried to highlight whatever I could, but there are even further challenges that many people have. And I'll be very honest, I've been quite lucky in the journey that, my challenges have not been too many. I have had quite a straight path, so to say, even though unconventional, but it's been quite straight. So, it's easy to get influenced rather than inspired by people like us talking about unconventional paths and other things. But I tell this to people, right? And I also do a lot of career advice and mentorship things on TopMate and Mentorly and platforms like that, where I tell people that it is one is it's easy to, like I said, get influenced by what somebody's saying or seeing somebody's interesting career journey. But you have to be prepared for all the challenges. You also have to be prepared for a backup plan. I see a lot of people who want to, probably just finish MBBS and very quickly jump into like, I want to do AI, I want to do this. I said, what are your plans? How do you see your career? What do you want to do in 5 years? Is it a lot of decisions sometimes happen out of two or three things. One is immediate passion around things because of the buzz that is happening. Uh, it's a buzz. So a lot of people want to take it up and do it because it sounds fancy. You had, I think, millions of TikTok creators which spurted very quickly in the world because, it was very fancy to become an influencer. So everybody did it. And we know not everybody gets brand collabs and not everybody is making money out of the content that they are creating. So be prepared for those paths. Be prepared to know what happens and where it happens. When you sometimes talk to people, industry experts, they all have spent a significant amount of time in the industry to understand what they want to do and where they want to be. So, and if you're doing it like within your MBBS days and getting influenced by something, it's a good thing. But be prepared and understand what the path is, where the journey lies, what your aspirations are. For somebody sometimes wants to be on the business side of things only. And if they ask me, I say, don't do the MD, right? Do an MBA after your MBBS, and you can open even broader horizons, and it can help you impact that. There are some who want to say, no, I want to be on the business side, but I want to maintain the scientific element very strongly into it. Then of course, you can go for your MD in pharmacology as well. Then, there are people who say, no, I don't want to quit clinical practice, but I want to do an unconventional thing on the side. Then you opt for something clinical and then see what all, non-clinical or whatever other things you can contribute. There are these Doctors for AI group, which is, I think, founded by a lot of diabetologists, who are and endocrinologists who are doing wonderful things. Like they are established in their practice, but they are building AI things for patient companion. They are building AI things to help doctors understand how AI can help them in practice, etc. So you can do many different things, considering where your aspiration lies. It's very early sometimes for us to decide. We don't have much visibility into a lot of postgraduate branches, most of them, even the uh, big branches that you see in your internship, and you work in medicine, surgery, and the large branches, and then they get into super specialists, etc. And your visibility is very limited. You are either influenced by some people working in that department or some big opinion leader you've heard in that field, etc., or some glamour with a field, sometimes something to do with sometimes the rank that decides which specialty you get, and okay, that if I get this rank, then I should do this only because this is what people should do at that rank, whether you like it or not. Sometimes, so there are many ways in which you decide that. You decide based on your available options. You decide based on how you want your career to look. You decide based on passion. You also decide based on earnings and practicality. That is also equally important, and not many people talk about it, but I think bread and butter is very important. So, passion doesn't feed your family, right? You have to earn for them. So, think of all these aspects when you make a career choice. Uh, Deep down, sometimes you know what you want. It's just about unearthing it. Talk to experts and always filter the conversations. Don't just look at the bright side of it. I think make it an active point when you speak to seniors in the industry or other experts. Please ask them, what are the challenges. And I really like the fact that, it's one of the few podcasts there where people have asked about challenges. I don't think most podcasts that I've been a part of, it's mostly always been about the bright side of things, and the overall landscape and all of that. And this, I think, is a very, very welcome change where you are targeting it to people to understand that there can be challenges and there will be challenges. So ask people, what are those challenges that you face? What are the challenges that I have to face? What is the downside of this career path that I'm trying to take? You should know how deep the well is. There is no harm in jumping in the well. I'm not going to judge you, or nobody has a right to judge anybody who's jumping in the well, as long as you know how deep it is, how difficult it is to survive in it, how difficult it is to come out of it if you want to someday. You can take a choice that way. So it's a very, very personal choice, of course, but you have to look at all these variable factors and not ignore them at all. You sometimes don't get carried away. Don't get carried away if you find, my journey interesting and say that, oh, I want to do the same thing. Uh, it may not pan out the same way. So talk to people, understand them, know yourself, and take exposure into whatever you're getting. Early on, get exposed to more things, either by way of talking, either by way of listening to programs like these, or actively doing some projects and being involved in them. But uh, be exposed, because without an exposure, you will not know what you want to do and how big the world is. You only look at 10 departments in the hospital and you feel that's all that you can do in life. But the world is much bigger.
All right, sir. Thank you so much for these wonderful insights. Sir, when you first move into non-clinical roles, what were your expectation and how does reality compare, especially in terms of challenges and as well as growth?
Nice. I think when I entered, of course, I like I said, I've done a lot of research, spoken to a lot of people. So I had envisioned a career path the way I wanted. I think it was overwhelming. It was great. When I started off, I was very happy. I still am very happy in my career, but it worked. It was the way I envisioned it to be. Corporate and all of it. Certain challenges, of course, which come your way, which are not generally spoken about, right? Like visibility, corporate politics sometimes, and all of those elements. But you navigate those as well. It's part and parcel, I think, of any job that comes in. So to be honest, I think it expectation versus reality was more or less similar because I think I had a lot of prior information on it. Uh, uh, Not many things changed in reality from what I imagined, except the fact about sometimes that there is a lot of glamour associated with corporate roles, but there are a lot of dark sides to things which I think came across in terms of reality at that front. So one is that expectation versus reality again is is not very different because for me I think because as a person I do that thorough research of knowing how deep the well is. So while I go on that path, you can continue, but you should know where it ends and what probably are obstacles. So because you foresee a lot of them and most of them I think fall in place that way. Uh, I think some expectation versus reality differences come in the startup world for me, maybe because uh, you know the hustle that you envision, and the way it works, and there are day-to-day challenges, when you're building something, particularly where it's funding, it's clients, there's making something, and so there are a lot of things that go there. You really are not looking at the clock. You're not looking at what day it is or what time it is, and you're just doing it. So that I think is something where you sometimes there have expectations of things to move at a certain pace, but they don't move at that pace. You have expectations of something to turn out into this, but it turns out to be something very contrary. So I think in the entrepreneurial world, in the startup world, the expectation versus reality things are little different. In the corporate world, if you've spoken to enough number of people, you'll probably have understood what it is to navigate the journey. Uh, it also depends a lot on what expectations people enter that domain or that role or that job with. There are a lot of people who enter with either very not, I wouldn't say wrong expectations, but very expectations which are hearsay, or expectations that are in their mind. Like, I know I told one of my interns, a couple of years ago, that she had entered with a very Karan Johar kind of a mindset into the job. Where she thought, oh, how in all those dharma movies you see college life, which is shown like, oh God, this is so happening, so cool. And I said, you've entered like, this is like in your head, it is like a office of, some dharma movie, and, it's going to be like super cool, and you're going to have like fun things happening, and you're going to have all suited people in conference rooms doing all big things, talking stuff, and you enter a startup and you're like, okay, this is how it is, and you're like, oh, it's a remote team, you have three people there, you have this, very different. So sometimes people, and a lot of people in the generation I think that's going to listen to this come with a very fancy mindset of how corporate life is, and that, so it's not like that, right? It's very exciting to see people in suits moving with one nighters at the airports, and I think even when I was a kid I used to be like, I want to be one of those. And when that expectation hit reality, and when I had to be living almost out of a suitcase for quite long, and where every weekend you're taking red eye flights, isn't all that fascinating. So from that post, from nice happy, putting that wing from the airport window and putting it on your Insta story, looks good for 1, 2, 3, 4, 10 times. After that, you're like, I don't want to sit on this plane. I just want to go home. So those are like expectation reality, right? You have that glamour that, oh, I'm going to go, and you see people's pictures on LinkedIn and Instagram with in CMEs, and you're like, oh wow, it's so fascinating. And then when you go into those conferences, you actually understand what they are. So there are going to be certain differences. So yeah, I think it's not going to be the way it is shown on Instagram and LinkedIn. I can tell you that much.
All right, sir. Thank you so much for these wonderful insights. Sir, in your view, how is AI transforming healthcare, especially in terms of patient engagement and adherence? And how do you foresee as the next big step in this space?